Well, tonight the CDC is issuing a warning about the rising number of respiratory illnesses. Cases of seasonal influenza, COVID-19, and RSV are all up across the U.S. tonight. At the same time, the agency is tracking the risk of bird flu in both animals and in humans. Joining us now live is Dr. Vin Gupta, leading pulmonologist and NBC News medical analyst. Doctor, thanks for joining us tonight.
Joyce, it was good to be with you.
Okay, so first, tell us what's happening with bird flu and the limited information that we are getting through the federal government.
Well, that latter point first, we're not really getting anything at this point. And there is that pause in communications, which worry us at the bedside. Patients across the country, whether they're in Seattle or anywhere across our nation, rely on information that's not partisan and from these agencies, even just data, simple data, Joyce, on what's happening with these respiratory viruses. The last report out was actually January 17th. So this is worrisome. We're flying blind. On where we are with bird flu, at least the data that we have at the state level suggests that this virus continues to evolve. We saw that in the case of a young teenager in British Columbia, that the virus does seem to be finding a way to change once it's actually inside a human being, that it's figuring out ways to make patients sicker. It's mutating in real time. And that's the concern. We haven't seen a sustained human, or we haven't seen really any evidence of human to human transmission, which is critical because we know that flu, if there's going to be a pandemic, flu can be a big driver of that. But in the absence of any evidence of human to human transmission, bird flu remains a concern. That's something that we should be vigilant on. You're seeing very proactive approaches in places like California, but it's not a significant current concern to the general public.
There was a person with a severe case of bird flu in Louisiana, who I'm sure you're aware of, died earlier this month. Some started asking whether or not it could be sort of the culprit of a next pandemic. It sounds like that's not a valid concern, but people are starting to ask questions about that. What is your comment on that?
Here towards the end of January 2025, I'd say as we are right now, the worry about a near-term pandemic is lower. However, the fact that bird flu went from birds to cattle to now just in our state, Joyce, right before the holidays, we saw 20 big cats die. I mean, that is scary, very disconcerting headlines. And that's something that should keep us all very, very vigilant, because this is something that's impacting all types of mammals. It's not going to be far from posing a potential risk to us as humans when it comes to human transmission. So I think this idea that we need to prepare actively, new therapeutics, vaccines in the pipeline, more testing, especially of cattle, of other livestock like poultry. Again, as you're seeing in places like California, active testing to understand the extent of this, that's critical. But number two, the CDC, again, last week pointed out that there needs to be urgent evaluation of anybody that comes into any hospital across the country. If they test positive for flu A, to do the next level PCR testing to understand, is that actually bird flu? Because Joyce, to your point, because we're not really doing that advanced testing, even though the CDC has recommended it for about a year, it's hard to understand the true dissemination of this virus across the country.
Will vaccines against the flu or COVID-19, will any of that offer any added protection?
Unfortunately, no. And so the current flu vaccine does not appear to provide any durable protection against infection, or again, we have evolving data, but towards severe illness from bird flu. So it really targets traditional human flu, and that's the extent of it. What we do know is Tamiflu, a treatment, I'm sure many of your viewers are familiar with it. Maybe some of them have taken it, does treat bird flu. It's not, there's some concerns about effectiveness towards bird flu versus, say, human flu. But if you are, just actionable advice for all your viewers out there, if you do feel flu-like symptoms, fevers, total body aches, upper respiratory symptoms like cough, make sure you get tested, especially if you're somebody that's 60 years of age or older with a medical comorbidity, because we want to understand, are you somebody that needs Paxlovid if you're positive for COVID? Or if you test positive for flu, let's get you Tamiflu as soon as possible, because Tamiflu does have activity against human flu and also bird flu, but time is of the essence.
All right. Dr. Vin Gupta, thank you so much. Some great information, and hopefully on the federal level, that will get back up to speed and offer more timely information for our health professionals who really need it on a day-to-day basis. We appreciate you.
Thank you. Indeed.